When I first met Joe, he'd been through a long journey. He'd fortunately beaten prostate cancer, was cancer-free for many, many years. But unfortunately, it was the small set of patients that has been dealing with sort of those quality of life issues. And one of the biggest ones for him had been leakage of urine, or urinary incontinence for him.
The bladder was damaged, and that started the incontinence, which I could use one pad starting out, and then became 2 pads. And then I had to go to Depends, and then I had to go to several changes a day. And the cost of that ended up being over $200 a month in supplies. I found that any physical exertion and standing for long periods of time, I just couldn't control, and it kept getting worse and worse.
Prior physicians and urologists had been treating him for sort of what they presumed was one type of leakage, and that's sort of called urge incontinence. And so they'd been giving him medications, Botox, had tried even other sort of surgical procedures. None of those had worked for him, and so he'd been dealing with diapers and pads for many years until he finally got referred to me. I, with my expertise in reconstruction, sort of looked at it in a little bit of a different lens and sort of said, hey, I think this is probably stress incontinence, leakage of urine when you're coughing, sneezing, laughing, being active, which is really debilitating to men when they are active people to begin with. And so really sort of had a different view of it and said, hey, we have something that we can offer you. The artificial urinary sphincter, or the AUS for short, is like a clamp that goes around the urethra, and you've got control of that clamp. It doesn't affect anything with regards to your bladder, and you're able to go to the bathroom just as you were before. You have that same feeling like, okay, I have to go to the bathroom. Really, all this provides you is that it gives you that time to get to the bathroom, and then when you need to go to the bathroom, you can then undo this valve and basically open up this valve, allow you to urinate, and then it automatically closes, which is amazing. So it's really just a single button that you have to push to then allow that valve to open and close. The really beautiful thing is that this valve and this entire device, it's 3 pieces that it's made up of. They're all underneath the skin, underneath the fat, underneath the muscle, and no one would ever know that you had a device that's helping restore your sort of quality of life and continence again.
Mine has been 100%, and I guess I'm really fortunate with that. So no problems whatsoever. I'm very happy with it. I'm very happy with the doctor. Dr. El-Arabi has been really informative, professional.
We're very fortunate that we have a standalone men's health clinic, which is the only one in the Chicagoland area, which is amazing. So really a focus on quality of life issues for men. Really, I think it helps in terms of really saying, hey, you've beaten cancer, we can get your quality of life back.